Shows that cervical cancer is on the rise in the U.S. among black and white women. It's just one of several cancers that impact the female reproductive organs. Joining us now is Dr. Amanda Ramos, gynecological oncologist with the Hartford Healthcare Cancer Institute at the Hospital of Central Connecticut. Doctor, welcome.
Thank you for having me. Hi.
Great to have you. So what are you seeing with patients, and what could be the reason for this increase?
So across the country, and particularly in the South, we are seeing increased rates of advanced cervical cancers in both white and black women. Advanced cervical cancers are cancers that have left the cervix and have spread to the surrounding tissues. It's difficult to know exactly why this is happening. I suspect it's because of decreased pap smear screening, tests that detect early cervical cancers. However, I also do think that the COVID pandemic may have contributed to the decrease in the screening.
All right, doctor, what are some of the warning signs of cervical cancer, and what age are women most at risk?
That's a great question. So one of the most common symptoms of cervical cancer is abnormal bleeding from the vagina. So like bleeding between periods, heavy periods, bleeding after intercourse, or bleeding that happens after a woman's already gone through menopause. Some women will also have abnormal discharge, potentially pain in the pelvis, or in their abdomen. In terms of the age range, cervical cancer can affect women of all different ages, but we tend to see women greatly affected between the ages of 30 and 60.
All right, doctor, talk about what types of screenings can help detect cervical cancer.
So about 98% of cervical cancers are caused by the human papillomavirus, or the HPV virus. So one of the most important tools that we have to prevent cervical cancer is the HPV vaccine. The other tool that we use to detect cervical cancers is our pap smear screening. And so those tests can help detect cancer in their early stages, or can help detect pre-cancers. It's really important to see your gynecologist once a year and to obtain pap smear screenings per the guidelines.
All right, and doctor, what's the course of treatment if a woman is diagnosed with cervical cancer?
It really depends on the stage of the cancer. If it is a small, early stage cancer, typically patients will undergo a hysterectomy, so removal of the cervix and the uterus. If the cancer has spread beyond the cervix, typically the patient will receive a course of radiation with some chemotherapy.
All right, and doctor, what are the recommendations now for pap smears for women?
Absolutely. So women starting at the age of 21 should start to obtain pap smears with their gynecologist or their primary care providers. Typically, these pap smears are performed every 3 years between the ages of 21 and 30. Of course, if there's an abnormality on the pap smears, your frequency of pap smear screening will be more frequently. After the age of 30, if a patient's had normal pap smears during their earlier years, they can move on to every 5 years with HPV testing, so a pap smear with the HPV test added to it.
All right, great information. Dr. Amanda Ramos, gynecological oncologist with the Cancer Institute at the Hospital of Central Connecticut. Thank you for the insight.